Just a short time ago, we learned of the discussion draft of repealing and replacing the Affordable Care Act, Obamacare. And now the work really begins. The question here is, what is the language in that legislation? But more importantly, what are the consequences to Kansans and to Americans with this legislation? Look, Obamacare has caused problems for many people, and I was the first person to introduce legislation to rid us of Obamacare. But I also know that it needs to be replaced with something that improves the chances that more Americans have access to affordable health care. And that's a tough thing, but we have our work cut out for us. And so now I'll be analyzing this legislation based upon what it does for pre-existing condition. I believe people with a pre-existing condition need insurance coverage. What does it do to premiums, to co-payments and deductibles? Those have risen with the Affordable Care Act, Obamacare, and we need to make certain that it's headed the other direction. I also know that access to health care in many places in Kansas is a real problem. Our hospitals and other health care providers, especially in rural Kansas, often are hanging on by a thread. What does this do to make certain that even if health care is affordable, it's still accessible? How do we make sure that rural communities and the providers, the hospitals, doctors, pharmacy, and others who are so important to our communities are around to take care of patients? And then we have concerns about what the changes in Medicaid may mean to those with disabilities. And so we need to make certain that the things that are important to Kansans are treated in a way that health care, its affordability and its access is improved, not diminished. And I know that if it doesn't meet the needs of Kansans, it won't get my vote.